The following portion of Health Matters is sponsored by Salina Regional.
Colorectal cancer is the second leading cause of cancer death in the United States. Regular colorectal cancer screening is one of the most powerful weapons against colorectal cancer. I'm Daniel Craig, Cancer Outreach Coordinator at Tammy Walker Cancer Center.
March is Colorectal Cancer Month. Let's look at the big picture and talk about how common is colorectal cancer and who is most at risk.
It's the second leading cause of cancer death. Your risk of colorectal cancer increases as you get older, so if you're over the age of 50, you have a higher risk. However, we have seen an increase in the number of young adults getting colorectal cancer, and colorectal cancer is now the leading cause of cancer death in both men and women under the age of 50.
What are the biggest risk factors involved?
So your risk of colorectal cancer increases as you age. If you're a type 2 diabetic, your risk is also increased. And then if you have a family history of colorectal cancer, you're at a higher risk. Some of the ways to reduce your risk are getting to and maintaining a healthy weight, eating plenty of fruits and vegetables, and limiting red meat intake. It's also important to get plenty of physical activity. And then if you smoke, if you quit smoking, that'll reduce your risk of not only colorectal cancer, but many other types of cancers. And one of the most important things is just to know yourself, your risks, your family history, and to get regular checkups.
Let's look at the various screening options.
The colonoscopy is the gold standard for preventing colorectal cancer. Most individuals should start getting screened at the age of 45. If you do have a family history, you need to visit with your doctor to see if you should be screened at an earlier age. In terms of locating where you can get a colonoscopy, the easiest way is to check out the Salina Regional Health Center colonoscopy landing page. In the month of March, we also provide the FIT test, which is a stool-based test that checks for hidden blood in the stool. We have those kits available at all pharmacies in Salina, Lindsborg, Abilene, Minneapolis, and Concordia. You can complete the test, and we provide a prepaid postage reply envelope, so you mail the test back to us. The Salina Regional Health Center lab runs the test, and then we mail test results to both the individual and to their primary care provider.
Daniel, what would you say for people who've been putting off screening?
One of the biggest concerns is always the prep for a colonoscopy. And in the last 10 to 15 years, that has really improved. So it's really not as big of a deal as what people often think it's going to be.
Well, Daniel, thank you so much for some great information, and thank you for watching. For more information, please visit TammyWalkerCancerCenter.com and like them on Facebook.
More of Good Day Kansas after this.